Hi everyone, I'm following James McHale and I'm in a suit, so I feel like I should be doing the finance report. As my wife will attest, I'm not qualified to talk about finance, but I think I am qualified to talk about cancer care, and it's something I'm really passionate about. And the reason is that as a cancer doctor, several years ago I reached the conclusion that I don't think we're doing it very well. And I've dedicated my professional life since that realisation to trying to change things. I'm a cancer nerd, I make no apology for that. Largely because of the ageing of our population, cancer is a big issue in developed countries. In our society in Australia, it's rising by 3% in terms of new cases every year. And if you think about that, it means that every 15 years, we get about 50% more workload that our health infrastructure has to deal with. Cancer is just behind cardiovascular disease as the second leading cause of death in our society. And the very sobering statistic is that 1 in 3 men and 1 in 4 women in our society will be diagnosed with cancer by the age of 75 years. That means in an auditorium of this size, 200 of us will be so affected. In my day job, I'm a clinical haematologist. I can tell you that's a great conversation stopper at dinner parties. But it means that most of my clinical practice is dealing with people with cancer of the blood and bone marrow, like leukemia, lymphoma, and myeloma. And people think my job must be really stressful, but I see it as a very great privilege because I'm doing something that matters. And week in, week out, I see people at their very best. And I learn a great deal from my patients. And in that spirit, I'm going to give you 4 stories from the trenches in the war on cancer. The pictures that you'll see, by the way, accompanying each story are by an artist called Michael Petroni, who painted his cancer journey with Hodgkin lymphoma. And so on, from a website called the MAP Foundation in the United Kingdom. So I'll start with Allison, and Allison was a diminutive lady in her late 50s diagnosed with myeloma, an incurable form of cancer for which periods of long remission are typical. Now, the currency of her communication with me was denial. She turned up to all appointments, elegantly made up, do what she was told, and made it very clear she didn't want to talk about her diagnosis or prognosis. And eventually, as the years went by, I felt we'd reached a point where really I, as her doctor, had run out of good treatment options. And I went to see her on a Monday morning on the ward where she'd been for several weeks, and I said to her, look, I really think you need to know that I haven't got any more rabbits that I can pull out of the hat here. She laughed and said, well, I'm going to meet my maker, am I? And gave a nervous laugh. And so I said, look, I think you really need to get your affairs in order. I went off to my Monday clinic, and the nurses on the ward told me what happened next. She called in her partner and her mother, who were estranged, and got them to reconcile, and at 3 o'clock that afternoon, she died. And you might think that that's a terrible thing, but actually I think it was a good death, because having handled things her way for so long, when the time came, she did what she had to do to go peacefully, did it, and then died at peace with herself. Part of my job is not just saving lives, but it's also giving people a good death. Allison's case, to me, tells me the importance of the words that we say to people with cancer and indeed life-threatening illness. Communication is terribly important. The next lady is Janice. Janice was an elderly Polish lady who came to me in great distress with her husband because she'd been told at another hospital she was going to die in 6 months of her bone marrow disorder. And when I assessed things, I had to say, the scientist in me, that was probably true. But I took a different tack with her and her husband, and I said, look, there are things that we can try, and sometimes they work extraordinarily well, and we might get a lot longer than that. And so with a renewed sense of hope, we embarked on trying various treatments. Some of them worked for a little while, but after 8 months, she did succumb to her illness. And after she died, her husband was kind enough to gift me this, which in Polish society is a wood carving of an owl. And in Polish society, that's associated with wisdom. And so her husband thought that I was wise, and I'm not so sure about that. I think it was more a matter of being compassionate, because I restored hope. And to be without hope, which is part of the human condition, is to be less than human. Janice's case tells me the importance of hope. Thankfully, not all of my cases are bad news. And Tammy was a young woman in her 20s who came up to hospital every fortnight for 16 weeks for chemotherapy for Hodgkin lymphoma. And things had gone well, as they usually do. And on the occasion of her last appointment with me, I said, the scans on the way through your treatment are all clear, it looks good, and I'll see you in 3 months. And at that, she burst into tears. And when I asked her what this was about, she said, well, I'm relieved to hear what you're saying, thank you, but actually I'm petrified. And I'm petrified of not being closely watched by the nurses that I've got to know. I'm terrified about going back and what do I do about work and relationships and so on. And so Tammy's case is a clear example of the need for people with illness to have a plan. Not just during treatment, but after treatment as well. The other thing about Tammy's case is that, in a different way to the 2 previous cases I've spoken about, it tells us the difference between curing and healing. Curing is the eradication of disease, whereas healing is making the best fist, psychologically or otherwise, of whatever hand of cards you've been dealt with in terms of your physical health. Very different things. Roy's case is my last vignette, but possibly the most important, because a chance comment from Roy changed me, changed my life, changed me from a doctor who felt like I had to show an open mind to a doctor with an open mind, a very different thing. And ultimately, Roy's comment to me affected the lives of many thousands of people. Roy said to me one day that it had taken him 3 months to learn how to be a patient. And when I asked him what he meant, he said, well, I had to learn the geography of the hospital, I had to learn the biology of my disease, I had to learn the terminology of the treatment, but I had to learn who I could talk to about what I was doing to help myself. And when I asked him what he meant, he said, well, out in the waiting room, we talk to each other, and people whisper to each other, for heaven's sake, don't tell Dr. X or Nurse Y that you're trying something like late trial or shark cartilage, because they'll poo-poo you, they'll humiliate you. And yet Roy is trying to be proactive with his health. And the road to Damascus moment for me right there and then, which I still remember very clearly, was either I was going to, as a doctor, buy into this controversial issue of complementary and alternative medicine, or forever have a barrier between me and my patients where we weren't quite rowing in the same direction. And for me as a doctor, that wasn't acceptable. And so I resolved to start reading about complementary and alternative medicine. And you can see from the definitions there, they're not the same thing. They're actually quite mutually exclusive. And we can draw a further distinction between complementary medicines, oral stuff, herbal supplements, what I mentioned earlier, and complementary therapies like yoga and massage and so on. I read more, and I learned that this historically goes back a long way to René Descartes, in fact, and his treatise in 1641, which was, sorry, I'm drying up here, I'm going to have a squirt. This is water, by the way. So Descartes wrote in 1641 his famous treatise, and it was subtitled On the Distinction Between Mind and Body. And the whole Western scientific method, rationalist, reductionist, population-based hypothesis testing, stems from his paper and is predicated on a split between the mind and the body. I learnt between the Flexner Report in 1910, because a lot of dodgy medical schools were starting up in the United States, and the conclusion of that report was that only those medical schools that taught a physical basis of disease should be supported by government. Very influential. After the report, about half of US medical schools closed or merged. Also influential in the United Kingdom, and further perpetuated this idea that the mind and the body are distinct. Now, it's interesting in the last 10 or 15 years that a new science referred to as psychoneuroimmunology is starting to show tantalising links between things like mood and personality and health outcomes. And the two are slowly coming back together. I started reading about complementary therapies. I found no evidence in favour of complementary medicines like laetrile or shark cartilage, but selected complementary therapies have what we call level 2 evidence, that is single-centre randomised controlled trials, and I'll just give you 3 examples. Acupuncture is good for the chemotherapy-induced nausea, particularly, for whatever reason, when it involves a pressure point on the left wrist. In a large US centre, music therapy was shown to reduce depression and length of hospital stay in people having bone marrow transplants. And there's quite a lot of papers showing that massage reduces anxiety in people with cancer. The chance came up through a benefactor to start a cancer support centre in 2000 at my hospital. And I resolved to do this, having been triggered into learning about this from Roy, to include in the cancer centre a range of complementary therapies. So the initial centre that we started on September the 15th, 2001, functions at several levels, still going. Firstly, a kind of quiet place. Drop in, have a cup of tea, talk to a meet and greet volunteer, retired chemists, retired farmers, medical students. Secondly, access to evidence. We have internet access and so on, and brochures from all of the support organisations. But then thirdly, and controversially at the time, access to a range of free complementary therapies. And the centre, on the day it opened, from then until now it's been 100 miles an hour, and something like 100 people a week still come into that centre. And so there was obviously a need being met by what we were doing. We are not claiming a cure. We have developed a way of selecting and credentialing therapists, and we try and base it on literature, evidence. We restrict ourselves to therapists where I feel like I can have some kind of clinical dialogue. We had applications from people who wanted to hang crystals over patients' chemo bags, and I didn't feel I could have a clinical dialogue, for example, with those people. Long story short, this has blossomed into the Solaris Care Foundation with 4 centres, as James mentioned, a large group of volunteers, about half a meet and greet and about half therapists. We've treated over 10,000 patients. We're currently administering 700 treatments per month. And we've done some in-house research that suggests improved quality of life and reduction in pain and fatigue as well. That's not proof yet, but it can say that we've had no medical misadventure over this time. And we get an avalanche of anecdotal feedback back from people, and those of us involved with the Solaris Care Foundation know that it does a lot of good for a lot of people. A couple of quotes from patients who, as usual, say it better than I can. I used to dread coming to hospital, but now I look forward to it because I get a massage after my chemo. So it might improve compliance with mainstream treatment. But my favourite quote is this one. Pretty much sums it up to me. Solaris Care has moved on, and these photographs show some of the other things that we do. Top right photo is a corporate day where we do massage in an office and tell people about cancer and about what we do. Bottom left, the lady on the left, Tricia Williams, runs Care for the Carers courses, where we teach partners how to look after someone with cancer, how to manage diet, how to administer the medicines and so on. The middle one is the Chemo Club. I was talking to a guy in the gym about the need and the role of exercise for people with cancer, and he said, well, I've got a gym, and within 4 weeks he'd started something called the Chemo Club, which offers people having chemotherapy the chance to go to a gym, starts with a walk around the oval, and then have supervised, safe exercise sessions. And if you join the walk around the oval, there's this fantastic sense of a collective wisdom emerging from people. The photo on the bottom right is the Men in the Kitchen cooking course for recently bereaved men. Some men can't cook, and if they lose their partner, it's a survival skill. So we take that as an opportunity to get them together. We have a trained chef, but we also have a trained psychologist. Australian men don't talk, but having something to do opens the gates a bit, And we find that the men start opening up and asking each other questions like, when do I start dating again? How long do I wear my wedding ring? What do I do with photos around the house? And so on. So the lessons for me from Solaris Care are, firstly, patients seem to come back to my practice at least a lot more prepared to ask questions. In the jargon, I think it's very empowering. But secondly, if you think about what's happening here, we're taking the very best of high-tech Western medicine, all of the drug breakthroughs and so on, and we're linking that with some very ancient forms of treatment to try and get the best out of both worlds to help people through the cancer journey. And this is a fundamental rewriting of a healthcare model. This is community-based cancer care. To sum up the problems, and the cases that I've given you summarise some of these, week in, week out I hear stories of poor communication, a 6-week delay between diagnosis and seeing a specialist where you're worried that your tumour is growing out of control, inadequate time with patients. My department's workload has tripled in the last 10 years with roughly the same number of staff, which simply means we have less time to sit and talk and express our humanity to the people we're looking after. This results in people feeling like they're on a production line, and lack of support or a plan at crucial times, and no lifestyle advice. Ladies and gentlemen, I think we can fix this. I think we have to fix this for our own sakes, and we can fix this individually and collectively. So for myself, I've made changes in my own medical practice. A couple of examples. I put breaks in my clinics so that if somebody needs more time, they get it, and then the subsequent appointments aren't running late. Another example, perhaps more profound, is that I've discarded my white coat. I was taught in cancer medicine that if you get too close to your patients, you'll burn out, and you have to hang back and keep some reserve. And I made a conscious decision several years ago that that didn't work for me. Instead, I just relaxed, was myself. If there were chances to say something about myself, my kids, the blues band I play in, then I would let it happen. And if I found myself befriending a patient, I would let it happen. And the upsides for that is that I can relax and be myself at work. I'm a real person to my patients, and the humanity in the room is there for us both to feel. The only downside is that occasionally I lose friends rather than patients, but that's not really a downside at all. For you, as I've said, sadly, many of us will know somebody close with cancer. You can help. Touch or hug them. Touch is a very powerful form of communication. Listen to them. Just sit and let them handle it their way, take the lead from how they choose to handle it, and respect their choices about how they handle a major illness. Suggest a spokesperson or offer to be one outside the household so that somebody else is doing with all the phone calls and updates and they don't have to talk about their illness all day. And finally, offer practical help such as transport, meals, hot meals on the doorstep, or childcare. At a wider level, we need to push for change, call it healthcare reform. If we were to shift a fraction of our focus and resources from this endless pursuit of curing towards the healing, it would make an enormous difference for the cancer journey for so many people. I believe we need to create teams around the person with cancer. I'm involved in an initiative to set up survivorship clinics where people do get a plan at the end of their cancer treatment. And I don't think we should be afraid of letting people with cancer get together and to let this collective wisdom re-emerge that's denied them otherwise. And we've heard today from Annie and from Shani about community. I think it's an emerging theme for today's TED session. Solaris Care tells me there's a role for the community to play in reshaping and reconfiguring our healthcare system to something very different. Ladies and gentlemen, Hippocrates is regarded as the father of modern medicine. I took his oath 30 years ago. He's quoted as saying, "Cure sometimes, treat often, comfort always." He got the curing healing split. I think if he were alive today, he'd be astonished at how well we're doing with the curing. But I think he'd be deeply concerned and sometimes appalled at sometimes how inhumane and even brutal our health system can be. Science tick, humanity, I think we're letting ourselves down. Our challenge is to find new ways to reconnect, to build communities, and to show we care. Thank you.